On the Money Watch, healthcare costs are on the rise. Now, according to a report from PricewaterhouseCoopers, health costs are expected to jump nearly 7% next year. It's likely that you will have to bear the brunt of that, though, but some increases are expected nevertheless. Financial planner Michelle Ogden joins us now to talk about this. So tell me, Michelle, welcome this morning. Thanks for joining us. How can people prepare for this?
Well, I mean, you really just need to compare. A lot of us, just like our auto insurance, when it goes up, we just pay it. And you really need to shop around, see what you really need, and then go for it.
Now, there's a lot of different insurance, obviously, when it comes to medical care especially. So should you bundle it, quote unquote bundle it? Should you get your optometrist and your dentist on the same plan? Do you do it separate? What do you say to that?
And again, it depends. It depends on what your needs are. If I had glasses, I may want to include that in my insurance because it may be better. If I've been self-insured for dental for a decade and it's worked out well. If you know that you don't have a chronic condition, then it may be better to do a HSA account. That's the high deductible plan. But the real important thing is that people have the high deductible set aside either in an HSA or in a savings account. And most people don't. They have an HSA because that's what they can afford and not what they really need.
Okay, so what do you say to people who say, I have this particular ailment, this issue, that issue? What do people really need in terms of health care?
Well, they need to know what they have in order to compare what's coming out. These prices aren't going into effect until after November, the elections. One of the things I say to do is go vote, do the things that you can do and comparison shop. Also, if you're on prescriptions, you can shop around and do like Costco and Sam's. They have great rates on those prescriptions. Another thing I was going to say is, I have to look at my notes, talk to your doctor about cost-saving alternatives. I mean, maybe you can go generic. Maybe you can do an all-natural remedy. There's just other options, and people just settle for what they're given as opposed to going out and fighting for what they really need.
Right. So the average person, let's say, well, I'll say average person, just say a person who doesn't have, doesn't even get seasonal allergies, just super not sick prone, just healthy all the time.
High deductible.
What do you say to that person?
Go with the high deductible. It'll save you in your premiums. And also fund an HSA. If you have a high deductible insurance plan, if you fund an HSA, you can put $3,300 if you're single, or I think it's $6,550 for a family, and it's before taxes. Just like you fund your IRA, fund your HSA, because you can use that money all next year.
Great. And quickly tell me how people can reach you if they need you.
MichelleOgden.com.
That sounds great. Thank you so much for joining us this morning. A lot of helpful tips for those who actually have ailments and need special care and those who just need regular health care.
Right.
Thank you so much, Michelle, for joining us. Have a great day.